Hi, Dr. Brian Heaberlin here with Lexington ENT and Allergy, and I'm going to discuss a problem called Bell's palsy today. So this can be a very disconcerting problem where someone suddenly has paralysis on one side of the face. One of the big concerns is have they had a stroke or not, because facial paralysis can be associated with stroke. There are other conditions that will cause the face to not work, but for some people it's this idiopathic, that's a fancy word for saying we don't really know why it happens, situation where the nerve that supplies the motor ability of the face just kind of goes dysfunctional for a while. Sometimes we think of viral illnesses as the usual cause of this problem. When someone has a Bell's palsy, the face will be sometimes progressively weak over a day or two, and then it'll stabilize for a while. And fortunately, it usually returns to full function over time. But not all Bell's palsies completely revert to normal function. Sometimes people can have a little bit of residual paralysis associated with it. One of the major things we want to make sure is that it truly is a Bell's palsy and not paralysis of some other reason. One of the ways you can tell stroke weakness from Bell's palsy weakness is in strokes, the forehead will usually be spared. So people will have paralysis of the lower division, such as around the eye, around the cheek, around the lower face, but their forehead is still able to be raised, or they're still able to raise their forehead, close the forehead down some. But in a Bell's palsy, that nerve is entirely out. And the reason the difference is there is because there's cross innervation of the forehead if it's on the brain side. But if it's on the peripheral nerve extending out from the brain to the face muscles that's damaged, then the face doesn't move on that entire side. One of the things we want to make sure someone doesn't have in a facial paralysis is a tumor or growth in the parotid gland. So our spit gland is right in here, called the parotid, and the facial nerve actually exits deep inside that gland. It travels through that gland and it branches into the various branches that give supplies to the upper division and the lower division of the face. So tumors of the parotid can sometimes cause a facial paralysis that can be misdiagnosed as Bell's palsy. So certainly someone has Bell's palsy and has a nodule in the cheek around the earlobe, that definitely needs to be evaluated because that could be a parotid gland cancer. Another condition that can cause something that mimics Bell's palsy is herpes zosteroticus, and that's a condition where you actually have shingles in the branches around the facial nerve and the hearing components of the inner ear. So people with herpes zosteroticus, or another term for that is Ramsey Hunt syndrome, will often have some blisters in the ear or around the ear. So if you have these little vesicles or blisters, that's indicative of shingles with herpes zosteroticus. People with Bell's palsy may have some facial pain, they may have some numbness, but primarily it's that facial paralysis. So if you know someone with facial paralysis, you certainly need to make sure the eye is protected. They have had a thorough evaluation by a physician, such as an otolaryngologist or another physician, to be sure that they don't have any other types of problems. If it is a Bell's palsy, fortunately most of those are going to get better over time. But unfortunately, not every one of those gets better over time. So I think it's always good to get checked, evaluated, treated, and get a proper diagnosis for this condition. Hope that helps. Thank you.